Good morning and welcome to podcast GP Podcast by Nadia. Today is Thursday and I start work at 11 a.m. So I'm just quickly recording a GP video podcast for you like that. I am traveling to Brisbane tomorrow for 4 days for celebrating twin holy days of Baha'i religion. I will not leave you alone because this is my passion, as you know. So I'll be recording small videos anyways, but then I just wanted to finishing is not the word because semaglutide or Ozempic or Wegovy is such a big topic. Obesity is such a big topic that I can do millions of podcasts on it. But I just wanted to give it the finishing touch that I had left yesterday. So this is basically episode 8, part 3, because for the last 3 episodes, we are talking about obesity and its treating medications. So yesterday we were talking about the injectable one that is the most favored injection and the most favored medication for not treating. Obesity can't be treated, but it is regarded as the most effective or efficient tool given to you to be able to overcome it. So as I said, semaglutide is the pharmaceutical name. Ozempic is the brand that is available on PBS for type 2 diabetics, and Wegovy is the private brand that is used for treating obesity. So treating type 2 diabetes mellitus and treating obesity, they both are interlinked and they both are attained by this medication, which is called semaglutide, which is a GLP-1 receptor agonist. Nowadays, Ozempic is so short in the market that even type 2 diabetics are actually buying Wegovy, because this medication along with metformin gives brilliant, excellent glycemic results. Their blood sugars are controlled like anything. So for them, they are also desperate, so they are going for private. I hope Ozempic's shortage for diabetics, type 2 diabetics gets resolved soon. So, as I said, that this drug is very, very important in also giving you cardiovascular, which is heart and vessels, and renal benefits, which is kidney benefits. We also spoke about the most common side effects, which are nausea, vomiting, egg burping, diarrhea. And they usually subside after a few weeks, but because it can be so bothersome, it has actually landed people in hospitals. So what I do with my patients is, though they are not significant, though they will subside by after a few weeks, but because some people cannot bear it, it just can become too much. So what I do is, when I started with my new patients, I asked them to precautiously, as a measure of precaution, they should take the anti-nausea medication regularly 3 times a day for the first 2 days, the day you start and the second day. And also, I sometimes put them on Nexium or pantoprazole or esomeprazole or omeprazole, which is one of the PPIs for guarding your stomach lining from the acid. The other side effect that you could encounter is called fatigue, because what happens is it increases insulin levels in the body, which in turn decreases the blood sugar levels. And because ones who are not diabetic, they don't really need hypoglycemia, so they sometimes can feel fatigued, but this is also nothing that you cannot overcome. Proper hydration and whatever you eat should be full of nutrients and should be healthy. And you can also take supplements. You can take vitamin D and multivitamins, including B12 and iron supplements with it, so that's not a problem. Avoid foods like beans, dairy products, like the ones that can cause you to have GI trouble. You should be avoiding that. And smaller meals. Anyways, you can't eat large amounts of food anyway, so smaller meals, and maybe not 3 times a day but 6 times a day. But just try, because as I said, Ozempic itself won't work for you if you don't include diet and exercise as daily part of your regimen. It is not suitable for pregnant women or women who are attempting to get pregnant. So we don't use Ozempic. Ideally should be stopped around 2 months before, or as soon as you start trying to get pregnant, you should stop it. Okay, so what are the other serious side effects which are rare but can happen? Acute pancreatitis, as you know, because it stimulates pancreas, which is the endocrine organ which releases insulin. So sometimes it can be associated with acute pancreatitis. Very rare case. Haven't heard of any in my practice, but it is one of the written very rare, less than 0.1 side effects. Though it has got protective effect for kidney, but if somebody has pre-existing kidney injury, then it might exacerbate it because it increases dehydration with nausea and with increased urination. Again, consult with your GP. They will have a look at because if you already have kidney disease, then they will check your results, the last EUC results, kidney results, and then they will decide whether they should start you on Ozempic or not. Thyroid cancer, another myth in my eyes, but yeah, I haven't found any suitable evidence as yet that can say that yes, Ozempic is definitely related to thyroid cancer. I don't think so. And weight loss, when you lose weight, that in any form or shape, like if you do lose it by diet, if you lose it by exercise alone, or if you lose it by other drugs or anything, losing weight increases the chances of having gallstones, an attack of gallstones. So of course, Ozempic does the same. So it could be related to increased chances of developing gallstones, but it is not the side effect that is related to Ozempic only. Any form of mean of weight loss, whether you go through surgery, you go through other medications, you do not do anything, just do it with the exercise and diet, you are still at the risk of increased attack of gallstones. Alrighty, again, my videos, I always try and keep them short, but they exceed the time limit. See you guys soon. Happy Thursday.